Sustainable and purpose-driven change, thinking systems and creating social impact. Please put your hands together as I welcome to the stage Dr. Swati Piramal, Vice Chairperson, Piramal Group. A round of applause, please, ladies and gentlemen. And post ma'am's presentation, she will be joined on stage by her team members, Ramya Rajagopalan, Senior Vice President, Piramal Foundation, Dr. Sakshi Chandak, and Dr. Om Thakkar, Gandhi Medical Fellows.
Thank you to ET and all the organizers to invite me here today. I'd like to focus on healthcare because that is something that the word sustainable is very important to use to change India for the better. So I'm going to speak about how organizations actually use business for social change and also the strategies for sustainable solutions in India in healthcare. So the Piramal Foundation, of which I am the director, my husband is the founder, has 5,000 full-time staff and is the largest operating foundation in India. It operates in 25 states across the country and 175 districts. Its domain expertise is public health, nutrition, education, sustainability, and gender. The thematic areas are decentralization, digitization, leadership development, and inclusion of indigenous people. So 9 states have the maximum concentration of India's bottom quartile. That is what worries me the most. While we talk about the economy growing and Prime Minister really saying we're going to grow 8% or more, the bottom quartile of India is not really getting the benefit of this growth. So if you look at poverty, 41% is in the bottom quartile. You look at maternal mortality, is 126 in the bottom quartile, and so on. So the number of doctors, the health spending, or higher education, or education spending, all very low in that bottom quartile. If we can't take these 250 million people who are over there into the national average, we will not meet our SDG goals. We will not meet the growth that we planned for India. So the best way to achieve it is to look at how we can leverage the government. If you look at the philanthropic investment that all the foundations of India make together, our CSR spend, is really 0.1% of what the government is spending. And if that is so, how can we leverage and work with the government to make sure this outcome of the government is much better? So let's look at one of the problems, maternal mortality. It is one of the biggest indicators of health across India. And if we say this is the mother, in my family, 1 of 5 children die at birth, I don't know what to do. I don't know if doctors in the government hospitals are trustworthy. I'm confused whether to rely on the local dai or the doctor. I would prefer to deliver my child at home. And if that is so, we can solve the problem by training all these people, the nurse, the tribal healer, the government doctor, and so on, the surgeon. And so if you have to have systems thinking to solve this problem, not just enough to say, okay, the bottom quartile is 126, but how do you apply systems thinking to an issue like that? So we need appropriate structures in the state to solve maternal mortality. And the way we do it is using digitization, leadership development, inclusion, and decentralization. And you see the effects of all that. We can do it 100% better than what we are doing today. So how do we bend this curve? This is the maternal mortality rate. This is the projection. It's only 2060 or so that we'll have something that we can be proud about. But how do you bend the curve? And that is by really leveraging the government itself and by bending the curve and using systems thinking. So we need to work simultaneously in all the four areas: education, health, sustainability, and gender inclusion if we want to remove our problem of poverty. So I want to give you one example of where we've been working for 16 years. Rajasthan was the most Bimaru state of India in education. Today, where Junjunu is the district where the Piramal Foundation first started, the literacy is 100%. So it is school education quality index, it is the second inside India. And it's the most improved in education. So the curve can be bent, whether it is education, whether it is health, whether it is sustainability or gender. So the way we do this is not alone. No foundation or no company can do this alone. And you can only do it when you can get 2,000 or thousands of NGOs across 26 states working together as a team to transform the village, or you focus on gender, you focus on health, or you focus on education. And only then we can really bring about systemic change. The self-help groups that Piramal Foundation works with involve 26,000 women, 112 districts. The Prime Minister asked us to work in the aspirational districts across 112 of them. We started in 25. Now we work in all 112. Working with faith leaders, whether they are in a temple, whether they are in a mosque, and working with them, with the community, and helping in healthcare and all these gender issues, sustainability, and poverty. Those have really helped us achieve a lot. Getting media articles, of course, the press has its own really positive reinforcement of our work. International philanthropy is something that we work with. The Gates Foundation, the Michael and Susan Dell Foundation, and many other foundations. Ramya Rajgopal, who's here, is our head of partnerships, and she has roped in all these to help India's progress. Indian CSR, of course, with our major companies, we work with looking at these solutions. Publications in leading journals, and of course, working with universities. They are our knowledge centers, and they really help us bring change. So the foundation is therefore very well placed to orchestrate social change in the government, in the community, in the core capability, in industry partners and technical partners. So I would like to share a story with a short video of how I went back to teaching medicine after a career in business. And then my children were looking after the business, so I said no more of that. But I went back to teaching, and I started with the alma mater, KEM Hospital, Mumbai. And I said, how can we teach young doctors about leadership? How can we teach them about seva bhav, the idea of compassion? How can we teach them about looking at systems change, making everything sustainable? And so we took 25 doctors this year, and we did three things. We shared with them how to learn cognitive-based compassion. Training, it's called CBCT. It's started by Emory University and the Dalai Lama. And we taught them how to look at the purpose in life. And then we sent them to Bihar. Right from being 99%ers in Mumbai, they went to Bihar. And they learned about systems change. How can system change be applied over there? And finally, they will go to the tribal districts of Maharashtra to study the diseases of 100 million of our population who live in tribal districts. Their diseases are very different. The number or national average in tribal district much lower than the rest of the nation. And so these young leaders can actually help change things. Swami Vivekananda said, give me 1,000 good people and I will change the nation. So I started with 25. I want to take it to 1,000. And maybe across India, all over India, and maybe 1,000 young healthcare leaders can cause sustainable change in those indices which we have struggled with over 75 years of independence. Can I please have the first video? Thank you.
Halwa. How are you everyone? So reporting from Bihar. हम जिस लग्जरी में अब तक रह रहे थे उससे बाहर आके जो हम एक्चुअल लोगों से मिले इधर जो गांव में सब लोग थे, हमने कैसे थोड़ा अज्यूम किया था कि हम बिहार जाएंगे तो ऐसा होगा, उधर हमको थोड़ा डर डर के रहना पड़ेगा। तो मुझे बहुत अच्छी अपॉर्चुनिटी मिली है इधर आके, मतलब फील्ड विजिट में कैसे, मतलब एक्चुअल कम्युनिटी में जाके कैसे समझने के लिए क्या क्या प्रॉब्लम्स होते हैं, क्या क्या चैलेंजेस फेस करते हैं वो लोग। बहुत सारे स्टोरीज पता चले, बहुत सारे मोटिवेशन इंस्पिरेशनल स्टोरीज पता चला।
तो इन सब का पैशन देख के, इन सब का अपने कार्य के प्रति एक उत्साह देख के हमें बहुत खुशी हुई और हम इनसे ये सीखेंगे।
Just the compassion of them was so infectious or contagious that I also feel so compassionate to solve such many of such problems in my life. अगर मन में कीड़ा घुस गया ना कि कुछ सोशल चेंज लाना है तो कोई भी आपको डर ही नहीं होगा, मतलब मार भी देना है तो भी आपको डर नहीं रहेगा।
We also met with team in Sitamarhi, wherein district hospital team had exposure and training in semi-city, wherein they the teamwork and how did the change from self to system brought about overall improvement in their perspective towards their work, towards their commitment for patients.
I learned about compassion over there and I applied it in field over here this time. I talked to the people, I talked to the villagers, talked to the hospital staff, talked to the drivers. I could reflect how it was useful.
बिहार जो भगवान बुद्ध और महावीर की धरती है, जहाँ से परिवर्तन की शुरुआत होती है, तो ऐसे हम यहाँ परिवर्तन देखने आए हैं, जहाँ की हमने देखा कि स्वास्थ्य विभाग में जो परिवर्तन हो रहा है, डिजिटलाइजेशन हो रहा है और इंफ्रास्ट्रक्चर बढ़ रहा है, ये सभी चीजें हमने नोट कर दी।
Government here working about digitalization, improving their services, improving their healthcare facilities, working on their systems and all the things, adapting the new norms of new generation.
So I really felt that they have a great contribution in implementing these systems and making the government systems work the way we saw them today.
Meeting the ASHA workers and realizing how ASHA workers are the core of public health system in India. Like the work they do from filling the forms of newborn cares or NCD for the CBAC form for the non-communicable diseases. Like these are the core things which are required for the public health system to work, like identifying the patients and spreading the awareness.
Greeting our patients, talking them with empathy, listening to them. छोटे छोटे अगर स्किल्स इम्बाइब करेंगे तो शायद वी मे बी लाइक बिहार एंड वी एक्सपेक्ट कि बिहार और भी आगे बढ़े।
So they all went to Bihar and made news. So it's amazing that these young doctors could do this from KEM in Mumbai. Yeah, so may I ask two of them come up on stage because I'm so proud of them. Their parents told them, don't go to Bihar. Something will happen to you. But they want to learn how to be healthcare leaders. And I want them to just speak about their experience. Sakshi, you go first.
Good evening, everyone. I'm Dr. Sakshi Chandak from KEM Hospital. I'm very grateful for this opportunity from Times Now and Piramal Foundation and my institute, SAID GSMC and KEM Hospital, for giving me this opportunity to speak here. So I'm here from the first batch of Gandhi Medical Fellowship, and we are here to share our experience. So we had visits of one week. 1 week at Piramal School of Leadership in Rajasthan, and 1 week visit in Patna, Bihar. So in Patna, we visited district hospitals of districts like Sitamarhi, Nalanda, Gopalganj, Muzaffarpur. So during those visits, we saw how the labor wards, the maternal and the child healthcare wards work. So how they are using digitalization process, how they are using local art forms like Madhubani paintings to spread the awareness in the wards. So
during those visits, we met Dr. Sudha Jha, who is the district head of the hospital. So she was very inspired to work towards the people and towards her hospital to make the public health system better. We also met with ASHA workers, who are accredited health activists who work at the core level, at the villages level, who collect the information, who spread the awareness to the people of the villages using various forms, various pamphlets, and various information sheets. So we saw how the ASHA worker works at the core level of the villages. We also talk to the patients who have diseases which are endemic to the regions of Bihar, which we don't get to see in Maharashtra. So we talked to the patients, we interacted with them, and saw how public health system has brought change in Bihar. So the change which we saw in the Sitamarhi hospital was very pressing for me, because at Sitamarhi hospital, the staff over there was provided with the cognitive based compassion training, which we were given in Rajasthan. So in Rajasthan, all of the 25 of us people underwent this compassion training, which gives us insight about ourselves, about the people we care about, and then about the whole community. So it's a ripple effect which creates from within yourself. So this compassion training in Sitamarhi hospital has helped them bring about change. So there we were told that the hospital theirs are called Sadar hospitals. So before this compassion training, the hospital was called as Sadak hospital because the condition was very poor over there. But now after the compassion training, the hospital staff has brought about change in themselves, and that's why the people are happy with the services they are provided. So now the hospital in Sitamarhi, the district hospital, is preferred by the people for their ailments. So this is brought about by systems thinking, which Om will talk about more on. Yeah.
Good evening to one and all present here. This is Dr. Om Thakkar, and I am an intern medical doctor at KEM Hospital. I am extremely grateful to Times Now and for providing the opportunity to let me speak over here, and to Piramal Foundation and my institution for providing me opportunity to be a part of this fellowship. So, talking about sustainability basically means achieving a goal and maintaining it over a long period of time. Now, to achieve that, there is something called as leverage point. Leverage points are identified as checkpoints in any system, not only healthcare, not only public health. They are identified as checkpoints in any system that boosts or enhances the sustainability of that system. Like, for say, if we are talking about any uh, emergency room in any government hospital, so the leverage points can be the accessibility of the emergency room to the patients, the staffing of that emergency room, and also the medical supplies. So if first of all we need to identify these leverage points, and if we work effectively on them, I think that any system can be sustainable. So when I went to Bihar along with my team, I saw one thing. It was a very inspirational journey. Like, I had read what was the situation in Bihar 10 years back, and there were persistent efforts made by the foundation and the fellows, Gandhi fellows of the foundation, along with the government of Bihar. And while working, there were many hurdles that they found. If But they were persistent in their efforts, and at the end, what I saw, like 2 months back when we went to Bihar, what I saw was remarkable. I genuinely feel that we should learn from what is happening in Bihar, and we should be like Bihar. One of the examples which I would like to state from there was the boost in digitalization that was seen in Bihar. That much digitalization I haven't even seen in my own state, in Maharashtra. But in Bihar, it was achieved to a point that all the medical records of all the patients was centralized in a complete database. And if they go to any hospital, they can just get access to all the medical records and all their histories and examination just on by a click of on the phone. So that was achieved, and that was really remarkable. And I talked to the Asha Didi over there. Like my colleague here mentioned about Asha worker, they are the ground level healthcare workers. They work in the field, and visit every household in the village. So initially the ASHA workers didn't used to get their pays. They are paid like there is a meager pay of 10,000 rupees a month, but they were not paid that. But after digitalization, they used to get that pay timely in their bank accounts. So I was really inspired by the work that they were doing in Bihar, and it was great to see that. Now, finally coming to an end, I would like to talk about purpose. Purpose basically has three things, three meanings. So, one, a purpose should be beyond self. It should extend beyond self and towards the people around us. Second is it should be long term. Long term means sustainable. And third thing, it should be achievable. So if we all identify our purpose and define it in these three manners, I think that any system that we work on can be made sustainable. Thank you so much.
So it's amazing when they say Maharashtra should be like Bihar. It's amazing. So I think that other states are making strides in using technology, and they are gaining in healthcare and other important issues. If you think about, let's say, Jammu and Kashmir, you think about what's happening there, the whole geopolitical system, the kind of weather that you have. And I'd like to just briefly show you how the maternal mortality was completely reduced in Jammu and Kashmir. Just move that middle chair. Just move that middle chair. Oh, sorry. Can you just move to the Baramulla, please? Sorry.
मेरे साथ की जो लड़की
Do you have the Baramulla video? Sorry. Just give me.
मैं डॉक्टर परवेज़ मसूदी डिस्ट्रिक्ट बारामूला JNK से ताल्लुक़ रखता हूँ। डिस्ट्रिक्ट बारामूला एस्पिरेशनल डिस्ट्रिक्ट में आता है। प्रेजेंटली मैं एज मेडिकल स्टूडेंट एसोसिएटेड हॉस्पिटल गवर्नमेंट मेडिकल कॉलेज बारामूला में काम करता हूँ। 2020 में मेरी अपॉइंटमेंट हुई थी ब्लॉक मेडिकल ऑफिसर बोनियार, जो कि नॉर्दर्न मोस्ट एंड ऑफ कश्मीर है और डिस्ट्रिक्ट बारामूला का लास्ट एंड है। ये इट इज़ सराउंडेड बाय द LOC के साथ साथ ये हिली टेरेन्स है। इसकी डेमोग्राफी बड़ी डिफ़िकल्ट है। यहाँ पर कोविड के दौरान हम जब चले गए तो हमारी कोशिश रही कि डोर टू डोर वैक्सीनेशन करें, और डोर टू डोर वैक्सीनेशन के साथ साथ हमें ये लगा कि और भी चैलेंजेस हमारे ब्लॉक में हैं। इस ब्लॉक में सबसे ज़्यादा चैलेंज हमारे लिए एनीमिया था, आयरन डेफिशिएंसी एनीमिया। उसके साथ साथ जो इंस्टीट्यूशनल डिलीवरी को पक्का बनाने के लिए 100% और इम्यूनाइजेशन कवरेज को 100% बनाने के लिए भी हमारी कोशिश जारी रही। तो इसको काउंटर करने के लिए हमने इनिशियली एक अवेयरनेस का प्रोग्राम किया, जिसमें इंडियन आर्मी जो स्टेशन हुआ है उन्होंने लॉजिस्टिक हेल्प की, उसके साथ साथ उन्होंने मोबिलाइजेशन में भी हेल्प की, जो बहुत हद तक हमें एनकरेजिंग लगा। फिर ये चीज़ें हमने डिस्ट्रिक्ट एडमिनिस्ट्रेशन, डिप्टी कमिश्नर बारामूला, CMO बारामूला के साथ ली। आज की डेट में हमने लगभग ये चीज़ें सबकी इंस्टीट्यूशनल डिलीवरी हमारी 100% है, इम्यूनाइजेशन 100% है, और मैटरनल इन्फेंट मोर्टेलिटी भी डिक्लाइन हुआ है। और इस सब में मैं थैंक्स करता हूँ पिरामिड फाउंडेशन का, जिन्होंने हमें अपने गांधीयन फेलोज दिए, जिन्होंने बहुत सर्वे करके और डेटा कलेक्शन करके हमें इसमें हेल्प की और डायरेक्ट किया कि डायरेक्शंस दी कि कैसे हम इसको अप्रोच करें और कैसे इससे हल हासिल हो। तो आज की डेट में हम ये कह सकते हैं कि हमने अचीव बहुत किया है और हम आगे भी अचीव कर लें।
100% institutional delivery, not seen in Maharashtra, not seen even in Mumbai. And these people have achieved it in the line of control. where there's so much snow, so much ice, and it has been achieved. So I'm so proud of what I call my small army. These are Gandhi Fellows. They are young people. We have bet on youth. Who's going to do all this work? It is only young people. And young people like this who have come from, they travel all over India. They are not afraid. They want to make change. They have great ideas and they have the technology. And if we can bet on young people, I believe the next session is on that. And how young Gandhi Fellows, we have actually 500 of them graduating every year. And we have 5,000 full-time employees. And we take in about 800 Gandhi Fellowships every year. So imagine that these young people, as Swami Vivekananda said, go to the community, wherever they are, even in Naxalite territory, even in Jammu and Kashmir, anywhere we post them, they go and they really make a difference. I think that's sustainability, making a difference on the ground. Thank you.
Ladies and gentlemen, I think we should have a louder round of applause for Dr. Swati Piramal and her team for showing us the inspiring work that they do on the ground. Thank you.